my name is Savannah. I'm going to be your nurse practitioner today. Can you just give me your name and date of birth?
Grace Leslie, 11/24/04.
Okay, good. All right, Grace, well today I'm going to be doing an assessment of your skin, your head, your ears, your eyes, your nose, and your throat.
Okay.
First, I'm just going to assess your overall skin. Your skin appears to be intact. I don't see any sores or any lesions, bumps, or lumps. I note one small little macule that may be 1 millimeter in size. I do note that you do have 3 ear piercings here on both ears, I see. And now I'm just going to assess your scalp. All right. Okay. No bumps or lumps felt in the scalp. Hair distribution seems and is equal. There is no breakage or anything in the hair. Now I'm just going to move on to your sinuses here. Your frontal sinuses, your maxillary sinuses. Any pain whenever I felt any of those?
No.
No? Okay. And while palpating that, your skin was noted to be warm. I'm just going to assess your capillary refill here. Less than 3 seconds, no clubbing noted. And now I'm just going to feel your temporal artery here. Okay, good. And moving on now down to your TMJ. Go ahead and open your mouth for me and close. Okay, good. All right. Overall hygiene looks good. No smells noted. So now I'm just going to move on down into your eyes, okay? All right. So overall, your eyebrows look good. They also have even hair distribution, and so do your eyelashes as well. Just an inspection of your eyes. There is no swelling, no redness, no drainage noted coming from the eyes. The sclera is white, no jaundice noted. I'm just gonna feel your eye and pull down here. Conjunctiva on both eyes is nice and pink, no swelling, no drainage noted there. Your lacrimal duct is also intact as well. Okay. All right, so now I am just going to get out my ophthalmoscope for my next exam here. So first I'm going to palpate your occipital bone back here. Okay, and then your frontal bone here. Okay, good. So now I'm gonna move on to do your eye assessment, okay? So first I'm gonna assess your vision. So go ahead and close one eye for me. So read whatever line you can read.
9, 3, 7, 8, 2, 6.
Okay, and then with the other eye.
4, 2, 6, 7, 3, 9.
Okay, good. So you're anywhere between 20, 25, and 20/20 vision. All right, so now what I'm going to do is something called the 6 cardinal gazes. Okay, so you're just gonna follow my finger. Okay, good. So next I'm gonna test your peripheral vision. So all you're gonna do is just follow my fingers and tell me when you can see them.
Stop. Stop. Stop.
Okay, good. All right, so now I'm going to assess your eyes, okay?
Okay.
So I'm gonna grab my pen light here. And I'm just going to assess the reactivity to light. Okay, good. So now I'm going to use my ophthalmoscope here. And I'm just going to assess your red reflex. All right, no broken blood vessels noted. Okay, good. All right, so now what I'm going to assess is you're going to follow this pen light to your nose. Okay, good. All right, so now what I'm going to do is just assess your ears. So ears appear to be symmetrical. There's no extra swelling, no drainage, no redness noted on either ear, no sores or lesions either. Now I'm just going to pull up on your ear here. Is that sore at all? I'm just pulling up on the pinna to make sure that it is not painful for the patient.
No.
Now I'm just going to get my otoscope here, and I am just going to pull up and back to assess your ear. All right, good. Tympanic membrane appears to be pearly and white, no bulging. Tympanic membrane is pearly and white on this ear as well. Small earwax noted, but that is normal. So now I'm going to do something called the whisper test. So what I'm going to do is just occlude this ear and whisper a word, and you're just going to repeat it for me. Okay, ready?
Apple. Orange.
Okay, good. Now I'm going to use my tuning fork. What I'm going to do is place this on your forehead. Okay, ready? Tell me which ears you hear, or ears you hear this in.
Both.
Okay, good. All right, next I'm going to place this behind your ear. You're going to tell me when you hear it stop. Then I'm going to bring it out front, and you're going to tell me when you hear it stop again.
Okay. Stop. Stop.
Okay, same one on this one. Tell me when you hear the stop.
Stop. Stop.
Okay, good. Okay, and now I am going to move on to your nose. Your nose appears to be symmetrical. There is no extra redness or swelling noted, no extra drainage. So now what I'm going to do is get my otoscope again. Excuse me. And I'm going to assess your nose. So go ahead and lift up your head for me. I'm just going to pick up this nostril here. I'm going to go ahead and take a look inside. Okay, good. All right, good. Nostrils appear to be pink. No polyps, lesions, or extra swelling noted in the nostril. No septal deviation either. So now I'm just going to assess your mouth. Overall, your mouth looks good. There is no extra lesions or any cold sores, extra swelling, any redness, any drainage noted of the mouth. All right, so I'm gonna have you just open up your mouth for me. All right, I'm just gonna use my pen light just to see nice and bright in there. Go ahead and say ah.
Ah.
Okay, good. So I do see a uvula that is midline. Both tonsils, go do that again.
Ah.
All right, good. So both bilateral tonsils are still in place. I do see your hard and soft palate are intact. Your mucous membranes are moist and pink. Tongue is also moist and pink. Dentation is also good. No broken teeth either. Hygiene of the teeth are good as well. Go ahead and lift up your tongue for me. Sublingual gland is intact as well. Okay, good. All right, so no sores or lesions noted anywhere inside or out of the mouth, okay?
Okay.
All right, so now what I'm gonna do is just move on to your neck here. By moving on, I'm just gonna feel your lymph nodes, okay?
Okay.
So I feel the pre-auricular here, the post-auricular, yeah, occipital back here, subtonsillar, submandibular, submental, anterior cervical, posterior cervical. I'm just going to move down here and feel your supraclavicular, and your infraclavicular. Okay, good. Any pain or tenderness whenever I'm feeling
No.
around there? No? Okay, good. All lymph nodes are felt to be less than a pea size. They are all mobile. No hard lumps felt in the lymph nodes, and no pain or tenderness for the patient. Okay, so now what I'm going to do is just move on to your trachea.
Okay.
So go ahead and just lift up your neck for me so I can see. All right, trachea appears to be midline. I'm just going to go ahead and displace this. Okay, good. Okay, trachea appears to be midline. It is displaced and dislodged easily. All right, so now I'm just going to come and stand behind you.
Mm-hmm.
You're going to feel me wrap around your neck here, and I'm going to have you go ahead and swallow. Okay, good. Thyroid is felt. No goiter felt on the thyroid. Any pain in swallowing?
No.
No? Okay, good. And then I'm just going to listen for a thyroid bruit.
Okay.
All right. Okay. All right. No thyroid bruit heard as well. Okay, Grace. That completes my assessment that I have today. Do you have any questions?
No.
No? Okay. It's been great to see you again. If you have any questions, just reach out.
Okay, thank you.
You.